You asked what I would say to Mike Pence. We're continually told that our loved ones are safe in this establishment. I want Mike Pence to come and sit with my father-in-law for an hour in this facility, if it's that safe. I would also say that the procedures that you guys have, that the CDC have in place, are not working. This disease seems to be contagious before it's symptomatic. Why are we waiting until people are symptomatic? And especially for a population like this, that's a death sentence. I think we're 0 for 8 right now, right? Everybody here who's been tested positive has, I believe that's the case, has now died. So if you're testing positive, why even move them, right? Like that, it's done. So I want Mike Pence, I want the CDC. The CDC needs to change their approach to this. We've been promised tests. It's a day later and we're still no tests. I don't know how long it takes to get tests here. I still don't see a large CDC presence. And like I said, I'm one of the lucky ones. I'm waiting for that phone call and I don't want it to come, right? So selfishly, that's why I called this today, because yesterday we were, one of the VPs from LCC told us that they had this new procedure in place, that we would have daily updates from a care representative that's been assigned to each of us. And then today Pat emailed me on that group thread and said, can you call me? My mother has passed away. I'm not trained as a counsellor, but I spoke with Pat. We were on the call together when she said, hold on, I have another call coming through. I think it's the care centre. She called me back 15 minutes later. She said, you won't believe what just happened. I've just had a phone call to say that my mother is fine. Yeah. And it was at that moment that we decided that we needed to up the game a bit and see. So, and then from an anger perspective, I know a lot of people have said they're not angry at the care facility. At the start, I was incredibly angry with the care facility and frustrated. And my anger now lies squarely with, I don't even know if it's the CDC or the BOH, I don't know, or the DOH, I don't know who we're supposed to be angry with. I don't think that the Life Care Centre of Kirkland have done a particularly good job, but I don't think they're equipped or trained to deal with this. And we still don't have the people whomever the people are who are supposed to fly in and deal with this highly infectious, deadly disease, they're the people that I'm personally incredibly angry with. And I'd like to speak to them. I'd like to speak to them in the facility. That's where I want to speak to them. If this facility is safe enough for my father-in-law, I want Mike Pence in that facility. I want Dow Constantine's. Any of them who have elderly parents, I want their parents in this facility. If it's safe enough for my father-in-law, it's safe enough for their parents as well. That's how angry I am, and that's how frustrated I am.
Had been in and out of hospital for issues unrelated to the coronavirus. But when they were tested at the Royal Berkshire Hospital last night, it was confirmed that they had the virus. The death is the first in Britain, where there are now 116 confirmed cases. The Chief Medical Officer says the UK is preparing to move from the contain into the delay phase of dealing with the outbreak. The second phase means that measures to tackle it will now be ramped up. Our health and social care correspondent, Victoria MacDonald, has this report.
Since the first cases of COVID-19 were found in the UK, it was inevitable there would be some deaths, yet it still came as a shock. Late this afternoon, the Royal Berkshire Hospital said that a patient has died. In a statement, they said,
"Sadly, we can confirm that an older patient with underlying health conditions has died. The patient has previously been in and out of hospital for non-coronavirus reasons, but on this occasion was admitted and last night tested positive for coronavirus. The family has been informed and our thoughts are with them at this difficult time."
Our sympathies are very much with the victim and their family. But the situation is pretty much as it has been, in the sense that we're still, Sam, in the contained phase, though now our scientists and medical advisors are making preparations for the delay phase.
Only this week, the NHS told all 135 acute hospital trusts in England to routinely test anyone in intensive care units who had a breathing problem. This patient is believed to have contracted the virus in England, and contact tracing is already underway. The evidence so far in this global epidemic is that the elderly with underlying health conditions are at higher risk of dying from COVID-19. Like many care homes, Nightingale Hammerson in South London is already putting in place contingency plans.
At the moment, we are mainly focusing on the prevention of any kind of spread or outbreak. We are speaking with the residents, relatives and all the visitors of the care home to prompt them to wash their hands with the soap and water as the most effective way of preventing the spread of coronavirus or any other sort of virus.
Staff were indeed being shown how to wash their hands today, and under ultraviolet light also shown just how difficult it is to remove all the germs.
Okay, you see your ring, your nails.
Yeah.
Like anywhere, coronavirus is making headline news.
I am concerned, but I feel just have to put up with it.
So are you worried?
I know more than anybody else. When my time's up, my time's up. So, but I do worry for my young people, my sons.
It is obvious why care homes have to take extra precautions. Elderly people are particularly vulnerable to this virus. So that could mean, if it reaches epidemic proportions, that they have to take hard decisions. That could include preventing visitors coming in or even stopping gatherings like this and keeping residents in their own rooms. MPs heard today that half of all the coronavirus cases in the UK are most likely to occur in just a 3-week period, with 95% of them over 9 weeks, raising questions about how the NHS will cope.
And the bit of the system which will come under pressure first will be those conditions that require people to have oxygen and particularly to have critical care beds. And that bit, I think, will come under pressure at quite an early stage if we have a high end of the range epidemic for this. Wider general services will be much less affected, and I think, for example, children's services, because children seem to be relatively spared from this disease, I think will be relatively much less affected.
With cases in the UK now over the 100 mark, experts say there is evidence of community transmission. That is, patients developing symptoms who have not been abroad. But the majority of the cases are still imported, and tonight the NHS said people returning from anywhere in Italy, not just northern parts of the country, should self-isolate if they believe they have symptoms of the coronavirus.
Victoria MacDonald with that report. Well, joining me now by Skype from Oxford is Professor Sian Griffiths, a public health expert who's an Emeritus Professor at Hong Kong University. She co-chaired the inquiry into the SARS outbreak in 2002 and 2003. Thanks for coming on the programme again, Sian. What is your reaction, first of all, to this very sad news that the first British victim has died of the coronavirus here?
Well, it is sad news, and our thoughts are obviously with the family. But if we look at what our expectations, we did expect the numbers of the cases of the disease to grow. We did, and as they grow, then unfortunately some people will not survive. So it's. I know everyone's saying this is a shock, and I think the reason it's a shock is that we've been in a situation where the majority of cases in the country have come back from overseas. We've been able to trace where they've come from, and that's sort of comforting in a way, because you can trace the pattern of disease. When you can no longer work out where the disease has come from, when we've got community spread, that's when anxiety grows, and I think this is symbolic of the growth in anxiety, that we may have more people in the community than we know about who have the disease, just as they found in other parts of the world.
Of course, we'll get onto that in a minute, but this patient only tested positive last night and died during the course of the day. Does that tell you anything in particular?
I know nothing about the clinical nature of or conditions of this patient, so I really can't comment on this case. Okay. So I don't think I draw anything very much just from the facts that we've been told.
All right. Now, we saw in Victoria's report there, lots of elderly people who are, in varying degrees of worry about this. What should elderly Britain's citizens do to protect themselves from this?
The messages remain that we should all be very careful about washing our hands, and that's all of us, and not just the elderly people who, I think I possibly come into that group as well. And, we need to take it more seriously, that we do need to wash our hands properly. We do need to make sure we don't touch our hands and our eyes. We need to take all those containment measures as seriously as we can. And at the same time, I think keeping healthy, that also helps. Right. So that helps to be keeping healthy. All of us need to keep that message and to keep on with life as normal as possible, whilst being aware that obviously the virus is around. So if we get symptoms, to report the symptoms to 111. That would be my advice.
Okay.
Because you know, that's sort of carry on life as normal, and the decisions about other things that will happen around us will be taken by local authorities or by the government.
Now, we mentioned Italy in the introduction there, and the number of cases there really is quite alarming. I mean, I think the infections over 3,000, the numbers of deaths, I think 150. You know, given the increase in cases in this country, is Italy our imminent future? Can we be where they are in 2 weeks from now?
Well, these are questions that one can't answer. It is a possibility. It's probably not a probability. It's a possibility. But I think the appearance of the disease in places like Korea or Italy have been that the cases have there's been quite a focus for the disease. It's probably been in the community a while before it's been diagnosed. And so it's got a grip. And that definitely happened in Wuhan. The disease got a grip in the community before it was made more widespread. Knowledge of it was made more widespread and the containment measures were put into place. So we have been doing a lot in this country in terms of raising awareness, in terms of preparation in the NHS, preparation in other sectors. So there's lots of planning that's been going on. The real question is, will the plans work when we need them? And, you know, will the pressures be too great?
Indeed. Sian Griffiths, we've run out of time. Thank you very much indeed. Jackie.
Okay. Thank you.
Well, earlier I spoke to Jeremy Hunt, the chair of the Health Select Committee and former Health Secretary. I started by asking, now we have moved closer to the delay phase in dealing with the virus. Is that an illustration of just how serious this is?
Absolutely. And it's not just that we moved into that second phase, but there is now very active planning going on for the final phase, which is called the mitigate phase, when we may have to get our heads around perhaps 20% of the population catching the virus, which is the prevalence rate in Hubei province in China, the epicenter of the disease. And so that would be huge in terms of the implications. It's not a prediction, but the preparations are happening for that kind of disruption. And that's why we heard, for example, that they're looking at allowing final year medical students to practice as doctors, or foundation year 1 junior doctors to do things they wouldn't ordinarily be allowed to do. So there is a lot of effort going into expanding the capacity of the NHS.
That does raise the question, are you confident, if this worst case scenario does happen, that the NHS can cope?
I do think the NHS is one of the best prepared systems across the world. I think it came second in the Global Health Security Index of countries around the whole world in terms of preparedness. And it's able to do things because of the centralised structures that other health systems find very difficult, like the decision this week to test all pneumonia patients. So there are some advantages, but the pressures will be very severe.
Yeah, and they're really critical pressure points, aren't they? Because Neil Dixon, the Chief Executive of the NHS Confederation, raises a really big concern today about whether British hospitals have enough respiratory resources to deal with everyone who might get this virus, and he thinks they don't. That's really worrying, isn't it?
That is definitely the biggest pressure point, because this is a respiratory virus. That is how it's spread, and the part of the population that are most at risk are older people who have long-term conditions affecting their breathing. And so that's what the preparations are being focused on at the moment.
But if hospitals don't have the respiratory resources to deal with that, that is a real danger for those older people who are most vulnerable.
Of course, and that's why they are looking at flexing the treatment. I know there's an enormous effort at the moment to reduce the occupancy in intensive care units to prepare ourselves. But also, I think there was honesty from the Chief Medical Officer this morning that there would be an impact even on some urgent treatments. But he was also confident that a system like the NHS is able to flex the care it gives. One of the points he made was that the peak pressure on the NHS will be for about 3 weeks. So there's a 3-week period when I think things will be very, very difficult. And what I know they will do is to try and make sure that as much treatment as possible happens either before that 3-week period or after it. But timing is therefore absolutely essential.
There is a question about whether the NHS anyway is coping. The National Audit Office today warned that there are not enough for nurses. And that surely is partly because of your failure as Health Secretary to deliver on that.
Well, I don't think it's the time for sort of having party political discussion, but I will answer that question very directly. When I was Health Secretary, I announced a 25% increase in nurse training places, and the National Audit Office did say today that there's been a 5% increase overall in the number of nurses, but it's probably not enough. You know, any health system, when you have a pandemic, is going to be under severe pressure.
On that critical issue of nurses, how do you make sure that we get enough nurses, given that post-Brexit, given that we're in the middle of a coronavirus where countries will be desperately trying to hang on to their nurses? We're facing a really difficult situation here, aren't we?
Well, we are, and that's why the long-term approach is obviously to train more nurses, and that's going to happen. But in the short term, there are lots of things that you can do to relieve pressure, and that's why the government's been talking about inviting back people who've recently retired. It's a very short period of 3 to 9 weeks where you have that big increase in pressure. And so there are things that you can do for a short period to relieve the pressure. But the timing is going to be absolutely crucial.
Are we moving towards a situation we're seeing in Italy, say, where you're talking about closing down schools?
Well, what Professor Whitty said was that is now the live debate in government. And it's a very difficult judgment call for ministers, because on the one hand, although children aren't the worst affected by coronavirus, they do appear to be capable of catching it and spreading it. Weighed against that is that if you start closing schools, then mums and dads can't go to work, and that will include doctors and nurses in the NHS who you very much need to be able to go to work. So it's a very difficult judgment call. We can see what's happened in Italy and in Japan, and I think that's what ministers are going to be weighing up very carefully in the next few days.
Jeremy Hunt, the former Health Secretary there. The number of cases continues to rise across the world. So what is the impact of COVID-19 on other countries? Well, in Iran, officials have announced new measures to fight the spread. Checkpoints are being set up to limit travel between major cities, and people are being urged to reduce their use of banknotes. So far, 107 people have died, and over 3,500 cases have been confirmed. In South Africa, the Minister of Health has confirmed their first case. It's now the 7th African nation to report an infection. The confirmed case is a 38-year-old man who had recently come back from a trip to Italy with his wife and 10 others. A number of sporting events have been affected. England's Six Nations game against Italy on March 14th in Rome has been postponed because of the outbreak. Organisers said the men's, women's and under-20s contests will be played at a later date.
As I stand before you today, we have more than 100 coronavirus cases in the United States. That is counting domestic cases and cases of coronavirus of Americans that were returned from China or the Diamond Princess. I'm pleased to report that most of those who contracted coronavirus within our care are continuing to recover. But sadly, we received word today that another American has passed away, and their family has our deepest condolences.
If you do get infected, if you're infected, as taking Seattle as the microcosm of that, it is exactly what Dr. Burke said. The risk of getting into difficulties is very heavily weighted towards people with underlying conditions and people with the elderly, where the young people, and there will be an exception here or there, the same way we see with influenza, but the risk for a young person who gets infected to getting into trouble is really low based on a lot of data that's coming out of foreign countries, particularly out of China.
Great. HHS has designated the coronavirus test as an essential health benefit. That means, by definition, it's covered in the private health insurance of every American, as well as covered by Medicare and Medicaid. And but we're working with members of Congress and we'll be monitoring the costs very carefully.
We are working in support of the California Health Department that's in the process of evaluating another cruise ship where they do have confirmed cases. We're at the very beginning of that, looking at the manifest to make sure we understand who's gotten off the cruise and where they got off the cruise, and we're really involved in that entire contact follow-up as we speak right now.
Well, to declare a national emergency, what's the threshold? The number of cases, the number of deaths, where you're going to take decision-making out of the hands of the states, and you are going to make, okay, we're going to quarantine a city, or we are going to shut down big events, or we are going to say no travel.
Well, let me just tell you
major decisions.
How that would be made. That would be made by very serious discussions among the task force. I would think that if we were in a situation, and hopefully we never even approach that, where you have clear, wide, diffuse community spread throughout the country, and you have to have federal mandates that come in to essentially enforce certain types of social distancing, I think it would have to come to that. But I'm a bit humble about that. I would like to discuss it with a variety of other people who have more of a handle on the implications of that.
And now to the coronavirus. Today we heard a dire warning. The CDC said what's happening now in the U.S. could turn out to be as serious as what we're seeing overseas. The virus has killed at least 9 people in this country. 126 cases are reported. That's across 16 states. That's all new today. And to give an idea of how this can spread, one case in North Carolina involves a person who was exposed while visiting Washington State and then later flew back home. The Seattle area remains a hotspot for the coronavirus. Jonathan Vigliotti reports from Kirkland, Washington tonight.
Tonight, officials say that a 54-year-old man who died last Wednesday might have exposed others before they knew he was infected. He lived at the same nursing facility linked to at least 5 other deaths in Washington State. Researchers believe the virus circulated undetected in the Seattle area for weeks. They fear there could be hundreds of undiagnosed cases.
I am concerned that this administration doesn't understand the seriousness of this and cannot downplay this right now. Communities need to be ready. Families need to be ready.
On the East Coast in New York, a city of more than 8 million people ramped up its war against the coronavirus. Today, city employees were seen wiping down subway turnstiles, railings, and ticket machines. Today, new details on the second New Yorker to test positive, a man in his 50s who works in a Manhattan law firm.
He is the first patient to be seriously ill, and obviously we're very concerned because of what appears to be previous respiratory condition, which creates more danger.
One of his sons attends SAR Academy in the Bronx, which has now been closed. 16 states now report the presence of the virus, which originated in China just a few months ago but has quickly spread around the globe. Nearly 91,000 worldwide have been infected so far, with more than 3,100 deaths. In Iran, this video appears to show dozens of bodies believed to be coronavirus victims scattered in a morgue in Tehran. And in Italy, the death toll has skyrocketed to 79. Back in Washington State, there's concern tonight the outbreak that began in this nursing home has spread to other states. Health officials in North Carolina now reporting their first possible case. They're waiting for the results of one last test. They say the patient not only traveled here to Washington State, but Nora visited this very nursing home before getting sick.
Jonathan, thank you.
说这个米还没盖的这个好呢。你这样你就把说还，好吧噻。 呀，有没啊？现在跑去啊？那你没东西玩，没东西玩哈。这是你对了哈。路还了，这两都该办个了。完了了，把油钱呀。这都该的。这靠đầu đi，这靠đầu đi。我靠đầu kia không？这靠頭呢度。我靠頭啫喎。啊？我靠頭嘅，好嘛？你呢個就得能邊個？我靠頭啊。係啊，我做緊呢個，我想做緊喐嚟呢。我做緊靠頭啦。係。咯，冇配合啊，冇。係，你搞掂。你一定都知啊，先啦。扣一下。哦，也係扣頭啊！有一個啊，係知人河一個啊，應該唔辣嘅喎，別應該唔要入場喎，憑彈路係啲路扣好啊。來人！來人！來了，我家我老婆哎。單年，聽你嘅，叫我靠邊，你應該來嘅，嚟了，兩個咯，哦，看見了，下公樓，我呢個。呀，好，这反正两边百姓都齐。哎，我看这个，快点，来，跳，好，往上走，走，你前面没注意，好。对，石头，看。我现在打死了，是有点口子。这个拿过来，再好很多。谁端？下过来。 对人民有一个对这些推荐修的。这个月还是这么钱吗？不是通过微信的吗？
是哪个说人少啊？啊，都排到大马路高头去了。刚才还马路已经占了一半了，这是进去了，好多人了已经。
你谁要谁来死？放生了，好几万样子。来上哪去？上哪去吧？命大的活着，不供饲料，不给咱。
One, they're laying right next to the sun there. You can see the jet just pumping it out. Obviously not a condensation trail continuing on like that, and there's another one coming up behind it. Pretty crazy. Enjoy your air while you can breathe it.
I want Mike Pence in that facility. I want Dow Constantine's. Any of them who have elderly parents, I want their parents in this facility. If it's safe enough for my father-in-law, it's safe enough for their parents as well. That's how angry I am, and that's how frustrated I am.